Gurv Mahagu Kahirlak. It is clear from the debate this morning that right across this House, members share a gratitude and pay enormous tribute to the student nurses and midwives and all their healthcare colleagues who have provided and continue to provide care across the entire service. Cathaoirleach, the Government will not be opposing this motion. I wish to offer my deepest sympathies to everyone who has lost a loved one, and in particular, my thoughts are with the families of the 93 people who have had their deaths notified yesterday. We all know that Irish nurse and midwife graduates are in great demand worldwide, and as we have heard today, the main reason for this is our 4-year degree programme. As Minister Donnelly stated earlier, the graduate education approach these programmes offer our student nurses and midwives is a hands-on learning approach as students, even though an essential part of their learning and the approach to building their skills is actively taking part in patient care. Clinical placement learning is on a supernumeracy basis from years 1 to 3 and the first part of year 4. The placements are between 8 and 15 weeks each year of the programme, and they cover the wide variety of clinical environments students need to learn in. The clinical placement in the 4th and final year of study is through an internship paid placement. This unique learning period focuses on the assimilation of skills, knowledge and professional behaviours learned over the programme to enable critical thinking and decision-making required to be a nurse or midwife. In addition, an important element of this clinical placement is the build in 4-hour time period of reflective learning per week for the student to reflect on their placements. Clinical placement for all the student nurses and midwives is the clinical learning environment in which they gain incrementally the practical experience, the necessary skills and the professional behaviours required to become members of the nursing and midwifery professions. Members will be aware that this clinical placement education time comprises 50% of the student nurse and midwife undergraduate programme. This significant proportion of learning time is prescribed by an EU directive and translated into the educational training standards and requirements by the Nursing and Midwifery Board of Ireland. Maintaining students' supernumerary status and offering the full student experience to achieve these standards is a proven success factor of all the nursing and midwifery programmes. Members will be aware that due to the current pressures on the health service due to the latest surge of COVID-19, in particular on critical care, a decision was made to suspend all supernumerary clinical placements from 1st to 3rd year nursing and midwifery students. This suspension is for a period of at least 2 weeks from the 18th of January 2021. This was a necessary decision, and as with so many decisions in managing care through a pandemic, it was immediate, in response to the particular clinical care demands at the time and the requirement for qualified staff. It is regrettable placements had to be suspended, and we are aware it will cause an unavoidable temporary delay and inconvenience for many nursing and midwifery students. The staff who support student placements are experienced staff with the skills and knowledge to support the current surge requirements. The Department is currently working with the HSE, the Higher Education Institutes, the Nursing and Midwifery Board of Ireland and clinical partners to ensure that students affected by the decision to suspend clinical placements will not be disadvantaged in terms of completing their educational programmes on time. The clinical oversight group in place since the beginning of the pandemic will continue to review the impacts of COVID-19 on the provision of clinical placements. This group will be an important part of supporting the safe reintroduction of supernumerary placements as soon as possible. In September 2020, following Surge 1, where all placements for all healthcare students, not just nurses and midwives, were suspended, clinical placements for all nursing and midwifery students were fully reinstated. As Minister Donnelly explained earlier, while COVID-19 continues to impact our communities and health services, each surge has impacted on the students' clinical placement education differently. Prior to this current surge, additional supports have been put in place for students to assist them in maintaining their clinical placements and continue this key part of their learning. The additional supports are in recognition that there are additional demands on students due to COVID-19 and they need to comply with public health requirements. Such demands may include getting additional and alternative modes of travel to and from placement locations, alternative accommodation and, in some instances, making changes to living arrangements. I will outline the relevant supports in a moment. All healthcare workers have access to PPE, training and occupational health supports. Students are also fully supervised on placement by qualified staff with the skills and knowledge to support their safety in the clinical environment. There has been ongoing engagement between health sector management, the student nurses and midwives and their representatives' unions, and this continues, including with the oversight group also. Maintaining student nurses and midwives on their education programmes and protecting their student status remains a priority. I want to reiterate the supports currently available to student nurses and midwives, including access to the pandemic unemployment payment for those students who may have lost part-time employment due to COVID-19. This is a specific exemption that Minister Donnelly secured for our student nurses and midwives. Enhanced illness benefit for those students who work part-time but have fallen ill due to COVID-19. The accommodation allowance of €50 per week towards alternative accommodation while on placement in clinical sites away from the base hospital is maintained. Additional travel expenses associated with clinical placements is also reimbursed. Other welfare schemes to assist with financial hardship due to illness, subject to qualifying criteria, including the supplementary welfare allowance and the urgent needs payment. Access for eligible students to the National Access Plan and Student Assistance Fund, and €250 top-up for those in receipt of the SUSI grant or €250 contribution to fees to eligible students. We have already heard the Minister today telling us that in order to ensure supports were in place for student nurses and midwives while on clinical placement during this time, he appointed Professor Tim Collins to carry out a short-term independent review of clinical placement allowances. He received this report on the 31st of December 2020. The key recommendation in this report is to implement a pandemic placement grant of €100 per week for each supernumerary placement week during the pandemic. This is on top of the supports in place for all clinical placements and the additional supports referred to a moment ago. The Minister has accepted the recommendations and is keen to progress the implementation of this additional support. In addition, the Minister has committed to a longer-term review of allowances for student nurses and midwife placements, and work on this is due to commence. The collective feedback we have heard from the students, the clinical placement support staff, the group directors of nursing and the heads of school and the higher institutes of education reflect the investment by the profession in educating their students and the importance to them all of supporting the education programme. We have also heard the challenges outlined, the difficulties, and in particular, the impact the pandemic is having on students and their education. The variety of supports in place, financial and non-financial, to continue to support students at this time remain under review to ensure safety and maintenance of the learning environment. I again want to commend the student nurses and midwives for their commitment to continuing their education to becoming nurses and midwives. The pandemic has shown us all the importance of having a highly trained, a highly skilled and an adaptable health workforce. Supporting our students to continue their education, protecting the graduate programme and maintaining their student status to do so remains a priority for the Government, the Minister and the professions. Gaurav Mahagud Kahirlak.